Today I'll talk to you about Wilson's disease. It is a very common disease of children affecting the liver in the country. Among the entire world, India is a hub of Wilson's disease because of our genetic makeup. And within India, Gujarat and Maharashtra are the two states which have very high incidence of Wilson's disease because of the genetic tendencies. What is important is to understand that if a child develops a liver disease, Wilson's is one of the very common diagnoses. If we get any child with Wilson's, we start treating them early by dietary modifications and also at the same time with the drugs that reduce the copper in the body. In Wilson's disease, the body is unable to handle copper, which we get in our diet, and copper is present invariably in almost all the food items that we take. The amount differs between low, medium or high. But if a child has Wilson's disease, the only way to treat and halt it is by immediately starting drugs which reduce the copper load in the body. They are very effective drugs. 90% of the children will be okay with these drugs and will lead a normal life. 10% of them may require transplant as life-saving because the copper load is excessive and which cannot be taken away only by the drugs because the liver would have failed by then. So essentially we can treat all the children with Wilson's disease very effectively, and please identify your children and help them live a normal life.